Our portfolio home care, we deliver person-centred care in a way that values and respects the uniqueness of the individuals that we support. We take the time to gain understanding of the individual, what matters to them, who is in their circle of support, how they wish the care to be delivered, if there are important times of the week and dates that they need that support to fit around, because we're coming into someone's life. So we need to deliver the support in the way that they wish it to be, and to look at who they are and what the outcomes they wish from the support. Part of finding out who the individual is by having a who am I within the care plan. This allows the individual to express their likes and their dislikes, explain to us who they are, and let us learn a little about their life, their history, what they've done, which enables care workers to not only support their needs at this moment in time when we're providing the support, but to understand who the person is. And it can also aid us in being able to match care workers. We work with GPs, nurses, occupational therapists if we feel that that person would benefit from assessment within the home environment, to enable them to use aids that will help them to be and remain independent for as long as possible. We also work with pharmacies and GPs and develop working relationships with those people, mental health teams, and other agencies that are important in allowing a streamless support across all avenues of the person's care. Our aim is to work with professionals to ensure that hospital admission is kept to a minimum and the person is kept at home for as long as possible. We also work with other reablement providers to ensure that that person can gain their independence after hospital admission or any other issue that has reduced, say, mobility or some other aspect. We will also look and identify if that person would benefit from assistive technology. We have people that use medication reminder assistance systems so that they can actually retain the independence of taking their own medication and can use their support for other things. We will work with employment support agencies. I've done so in the past for people with learning disability who are looking to get into the workplace, helping and supporting them with CVs and with interview techniques, working within the voluntary sector for people who may have not been able to do their gardening, but we will then work with organisations that can help them with support to do so. I've worked with Essex Learning Disability Partnership for people there. The whole point of providing the care is to keep it as flexible as possible, to make sure that all the risks are reviewed and that we have a detailed risk assessment, and that the person involved with the care and the person themselves understands the risk as well. And we are supporting them in a least restrictive way to be able to achieve the outcomes. Communication is incredibly important when you're planning support and care and delivering it. So we aim within that initial assessment to find out about the way the person communicates. Is English their first language? Do they need printed paperwork with larger print? Would the person use the picture exchange communication systems, or would Makaton, in which case we would be looking to train our care workers in those specific communications for that client? To understand if the person has a family carer, we signpost people to organisations such as Carers Trust for their support, and we may need to be working with advocacy services. And of course, within adult social care, the social workers allocated to the client to ensure that what we're providing is safe, that there are no risks, and that the client has outcomes that we are able to meet. Sometimes the outcomes need to be broken down into smaller blocks because anxiety may cause the client to be worried. But we work with the whole team to ensure that that client has the support that they wish, that will maintain and develop independence, develop skills, and ensure that they are part of the wider community and that there is quality within their lives and within the care that is supported in a way that they understand and in a way that meets what they have requested from us.